Hello, my name is Jennifer Bushnell, and I did my field placement at a traumatic stress center within Summa Health in Akron, Ohio. As part of my placement, I was offered the ability to co-facilitate skills building and intensive outpatient program groups that were trauma focused. This presentation will focus specifically on the intensive outpatient program specifically for trauma patients. As part of the IOP group, we implement mindfulness skills to contribute to PTSD symptom reduction. My supervisor and I chose an evaluation tool that would assess the patient's increase or decrease in mindfulness skills before and after IOPT. So first, let's just start off with the basics. What is mindfulness? Kabat-Zinn offers a definition of mindfulness of the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. Essentially, in summary, that's basically saying that mindfulness is being aware of the present moment and allowing yourself to reflect and non-react and without judgments on your thoughts, feelings, emotions, behaviors, and allowing yourself to just be with those. Banks, Newman, and Salim also offer a definition of a means of reducing avoidance, aiding emotional regulation, and increasing distress tolerance in traumatized individuals. Now, this is a more trauma-focused perspective. And as we get further in this presentation, we'll explore other areas where mindfulness is being used as treatment. But these two definitions are what I have used to base this presentation and this evaluation project off of. So, back to the question of what can mindfulness treat. It's been proven by several studies that mindfulness can treat anxiety, depression, eating disorders, chronic pain, cancer, stress, and, of course, post-traumatic stress disorder. It can also treat patients with psoriasis, females with neurotic anxiety, hemodialysis patients with anxiety and depression. More specific studies have shown college students with psychological distress, prisons, and many other populations. There are a lot of different and specific ways that mindfulness is being incorporated. A lot of those are mindfulness-based stress reduction and focusing specifically on the concept of stress reduction. That is not what we use specifically. A lot of the stuff that we pulled from in the intensive outpatient program is actually from the DBT manual, the Dialectical Behavioral Therapy by Marsha Linehan. She focuses a lot on mindfulness as far as using skills like non-judgmental stance, even as far as deeper into the book, the checking the facts, the stop skill, different skills that really force you to be aware of what you are thinking and feeling in order to continue to be effective in your interactions with others. So now as we move forward, it's probably a good idea for us to talk about what is post-traumatic stress disorder. I put the code there for the DSM-5 because it is a DSM-5 diagnosis. Now, post-traumatic stress disorder was not always part of the DSM. In fact, it was actually known as, a lot of us can refer to this as a diagnosis that is mainly given to veterans. While that is still true today, that a lot of veterans do have PTSD, it's also can be diagnosed to anybody who has these 4 clusters of symptoms from the American Psychiatric Association, or the DSM. And those symptoms, those 4 clusters of symptoms include re-experiencing traumatic events, negative cognitions and mood, avoidance symptoms, and hyperarousal. And as you continue to look at those 4 clusters, the overall preface for someone to be diagnosed with PTSD, they have to have experienced some type of traumatic event, traumatic meaning their life was in danger or someone close to them's life was in danger. It could be that they experienced it themselves, they heard it through someone else, it could be that they saw it. There's actually quite a few different ways that you can experience a traumatic event, and the very typical ones that we think of are sexual assault or abuse, domestic violence, combat and war, and there's a wide variety of them. But the PTSD Center, or the Center for PTSD, actually pulled right off of the American Veterans website, it says that about 7 or 8 out of every 100 people will have PTSD at some point in their lives. Essentially, getting PTSD, excuse me, it's not always inevitable. It doesn't mean that because you were a veteran that you're going to get PTSD. It's just basically how your brain interprets these experiences. We could get into the very, very deep details on who can develop PTSD and the protective factors against it versus the risk factors, but then we would probably be here all night. It's also important to remember that PTSD is a treatable diagnosis, and these are actually very normal reactions to abnormal experiences. How does mindfulness specifically treat PTSD symptoms? Now, it's specifically, I'm going to emphasize the word symptoms here. So PTSD will help, normally people with PTSD will develop habits of avoidance of feelings, emotions, thoughts, places, or experiences related to the traumatic event. An example might be if there was an orange. This is a very, very specific example. If there was an orange around during the traumatic event and you smelled the orange, then later on in life you might be somewhere where you can smell a cleaning supply that smells like orange. That could be a trigger for you, and so people might avoid things related to oranges or avoiding the places that traumatic event happened. But essentially what mindfulness does is it helps to bring awareness of the thoughts, behaviors, emotions that can lead to more effective functioning. Because if we are continuing to avoid our thoughts, feelings, emotions, and behaviors, or acting on those in an ineffective way, then that can definitely cause some distress in our lives. At the Traumatic Stress Center, we witness a lot of patients that have for years they've avoided their feelings and they've numbed themselves to it because they've not allowed themselves to fully process it. And what happens with a re-experiencing symptom is that your brain is just trying to process this event, this abnormal event. Your brain is trying to process it as much as it can. So what mindfulness does is it helps to bring awareness of these specific things, the thoughts, the behaviors, emotions, but then it also it helps us to observe, describe, act with awareness, not judge, and not react to whatever our thoughts, behaviors, and emotions are. Now, I'd also like to point out that the thoughts, behaviors, and emotions are very much related to cognitive behavioral therapy because they are all related together. And so mindfulness and CBT also go very well together. So the evaluation that I did was the 5-facet mindfulness questionnaire by Bayer, and that was published in 2006. I believe Ohio State also has a copy of this, but I did a one-group pre-test, post-test program design. So we weren't looking specifically at each individual. We were looking at the program as a whole. How is this intensive outpatient program with this trauma-focused spin on it teaching these patients how to use mindfulness skills effectively? So in essence, we weren't even evaluating the reduction in PTSD symptoms. We were actually evaluating their use of mindfulness skills. And so this was a 39-item questionnaire with a rating scale of 1 through 5, with 1 equals never and 5 equals always true. Some of the questions, well, let's start with this. The questionnaire is divided up into 5 categories, so all 39 questions fall into the category of observe, describe, act with awareness, be non-judgmental, and be non-reactive. And this is basically focusing towards those emotions, thoughts, judgments, actions, and behaviors. But as these questions are divided up, we'll get further in on how I did the analysis because it got pretty tricky. But basically, we implemented this for patients that were in the intensive outpatient program at the Traumatic Stress Center. We did the pre-test during their group orientation, and then we did the post-test at the end. So the way IOPT works is that it's Mondays, Wednesdays, and Fridays from 9 a.m. to noon with 2 15-minute breaks at the top of each hour. And on the first group, the first hour, the first 15 minutes of the first hour, we always do a mindfulness exercise. And these can be activities like deep belly breathing. We've done a lot of guided imagery, such as the mountain meditation or leaves on a stream. These are very popular ones, and a lot of different types of mindfulness activities pulled from Marsha Linehan's dialectical behavioral therapy. So, some of the results, I'm just going to try to go through these and explain them as best as I can. So I actually administered 32 pre-tests, but only 16 complete surveys, so that means pre and post-test were actually gathered. And basically what ended up happening is that some patients just didn't finish the program who had the pre-test, and some of them had forgotten. But there were 3 males and 13 females. I know that that is a huge difference. Unfortunately, I could not change that demographic. And then I also have on here that we looked at experiences in other services. So some patients were referred from the PHP or partial hospitalization program. Some had their own individual psychotherapy or individual psychology sessions. And then some were also in other groups at the Traumatic Stress Center. And so here is just a little graph or a little chart. I see it as a limitation because we don't know specifically if they are learning these mindfulness skills from these other services that they are enrolled in, or if they are learning them specifically from the intensive outpatient program. So the first thing that I did is that I took averages from each category, and as well as the total of all categories added together. So if you look at the averages, you can see an increase. I would like to point out that you can see the observe, describe, and non-react all have the post-test, which is this dark blue one. That one is greater, whereas the act and non-judge, it's the pre-test that is greater. And that's what we're looking for, because the act and non-judge are to be scored reversed. I know that's pretty confusing and that was challenging to do, but based off of the averages, we do see an increase in mindfulness skills in these patients, in these 16 cases. What I found was interesting, however, was that we discovered that there was no statistical significance based off of the p-value and effect size. So if we look at the p-value here, none of these are greater than 0.05. I'm sorry, 0.5. Therefore, they are deemed being there's no statistical significance. And then if we look at the effect sizes, the categories of describe, non-react, and the actual total in the end are of effect sizes that are small. The act category is a large effect size, and then the categories of observe and non-judge are very large effect sizes. Basically what this is saying is that the categories that are small, it just shows that those probably don't have as many specific mindfulness skills that are teaching those parts of mindfulness, as opposed to the categories of observe and non-judge, which are very large effect sizes, showing that we probably implement more mindfulness skills towards those specific categories. So some few points of discussion right here. The results can be utilized by the group facilitator to continue to implement mindfulness techniques to improve skill use. So based off of these results, because we did not find a statistical significance and looking at the difference between the effect sizes, it shows the group facilitator how she can best implement new strategies to increase skill use. There are a few threats to validity. So looking at this one, the threat to validity, that it is a self-report, because we don't know if patients are being truthful, but that could also mean an increase in reliability. There is another threat to internal validity, and I kind of pointed this out earlier in the limitation, that patients can be engaged in other services. So there's several other groups that are offered at the Traumatic Stress Center. Some of them need such a high level of care because they've come straight from partial hospitalization or inpatient, that they have to be in a group every single day in order to be fully functioning, or to learn skills to become fully functioning. However, like I pointed out earlier, based off of the averages, it does indicate that there is an increase in overall mindfulness skill usage per category. I found this very interesting because even though it wasn't statistically significant, we do see that the averages are showing us some type of increase in mindfulness skills. And those are my references. And I am open to any questions. Thank you so much for listening.